Hello, everyone, and welcome. This is our December Public Health Plus session, Public Health Plus Community Networks. As Nick said, my name is Michelle James, and I'm the Senior Director of Alumni Engagement at the Rollins School of Public Health at Emory University here in Atlanta, Georgia. We're thrilled to have all of you with us today. Public health touches nearly every aspect of our world, as is becoming clearer every day, especially given the current pandemic. It is at these intersections of public health and communications, design, business, social justice, etc., that we find the most potential for growth as individuals and as a society. The Public Health Plus series was created by the Rollins School of Public Health Alumni Board's Career Development Committee in partnership with our amazing friends at Orange Sparkle Ball to examine the spaces where public health intersects with other disciplines, discuss that work, and then broaden our thinking. We are thrilled today to have Dr. Teri Garstka and Isabelle Swiderski leading our conversation. Together, we will discuss how we can strengthen community networks to improve health outcomes. A little bit about our speakers today. Dr. Garstka is an Associate Director at the Center for Public Partnerships and Research at the University of Kansas, where she oversees a portfolio of research, evaluation, and data science initiatives in systems that serve children, youth, and families. She leads the strategic development of several software applications that support impact measurement and good practice in 7 states across the country. With over 15 years of experience in implementing or leading large-scale data-driven efforts in academic, government, and social service settings, Dr. Garstka's experience includes establishing data governance structures, aligning technical infrastructure, analytic tool methodologies, and measurement to address policy questions and turn data insights into action for better decision-making at all levels of social service systems. Isabelle is the founder of a design for impact agency called 725. Working with startups and social entrepreneurs, she seeks to build successful ventures that enable impact and accelerate the growth of value-driven organizations. Marrying advanced degrees in business and design, Isabelle has facilitated co-creation and systems change work supporting ecosystem builders in 10 countries on 4 different continents and in 3 languages. A sessional lecturer at Emily Carr University for more than 10 years, Isabelle is regularly invited to speak and teach on topics of design-led innovation, customer discovery, impact entrepreneurships, and gender diversity at work. Her podcast, Design Influence, features conversations on how we might collectively redesign systems that no longer serve society as they should. We are thrilled to have these ladies with us today to share their expertise and knowledge. And with that, I'm going to hand it over to Isabelle to facilitate our conversation. Thank you, ladies.
Thank you so much, Michelle. Thank you to Orange Sparkle Ball and, of course, Rollins for the opportunity to chat with Teri. I've had the opportunity to chat with Teri several times, and I'm super excited to hear, to share with you and have her explain to us what she's been working on. So, Teri, if you're ready to unmute yourself, then we can dive in. And can you tell us a little bit about, so we got a glimpse into using data to make better decisions. Can you tell us a little bit about what you're working on these days?
Sure. So let me give you a little bit of a background about what we do at our center. We get up every morning to make a difference for kids and families, and we are at an intersection between policy, practice, and systems that impact children, youth, and families. And one of the things that gives us an opportunity to work in early childhood, maternal and child health, positive youth development. So our center is multidisciplinary. We're psychologists, we're sociologists, we've got some public health folks. So we're really looking at social service systems and right now, and how to make them more responsive to kids and families. And so I'm gonna talk a little bit about this, and you and I have had a conversation about systems, and I want to kind of paint a picture of the kinds of things that we're interested in. What we have been finding is that in communities that are trying to serve kids and families and adults, there are some disconnects between, let's say, the early childhood system, or the public health system, or the healthcare system, or the education system. So what we're trying to do is figure out how to navigate these complex systems in ways that are useful for kids and families. So those are kind of complex problems that don't have clear solutions, and that's the kind of space that we're working in.
So what have you seen that's been helpful? Because you've mentioned a number of partners, and within the center as well, you have different backgrounds of folks. Why do you think this disconnect persists, and what have you seen that has worked, even in small ways, to move us forward?
Well, so let me tell you a little bit of a story of what we're going to be talking about. About 4 or 5 years ago, we were working in a community in Southeast Kansas, and I know I've got some Kansas folks on the call. And I will preface this by saying that most of our work is in social services. So rather than in the public health side, we're working in with communities and community-based organizations. CBOs is what sometimes they're called, social services. So social services covers a wide range of programming and systems. So when we think about social services, we're thinking about organizations that provide concrete support, things like housing, transportation, basic income, basic needs. We're also thinking about family support, domestic violence, other community-based organizations that provide supports for families. So we're mostly in the social service space, and when we start, and particularly in the early childhood space. So about 4 years ago, we were noticing one of the problems that we were asked to solve is how do we get more families engaged in services? And in multiple communities, multiple counties in Southeast Kansas stepped up to be a pilot in piloting a new tool that we developed. And let me step back briefly to say that at our center, we've had experience in developing software. And just to plug that, sometimes being outsiders developing software, social scientists developing software is a good thing and a bad thing. We didn't know what we didn't know. And so we designed a tool to solve one problem, which is to close the loop between partners who are engaging with families and referring to their other community-based partners. Okay, so what we noticed was that families were starting to fall between the cracks, and I'm putting that in air quotes, meaning what we were hearing is that multiple organizations were interacting with families, kids, adults, and recognizing need, maybe need for housing, maybe need for WIC, women and children, and infant care, and relying on antiquated systems of referring families to their partners. People were still using faxes, believe it or not. Faxes, emails, phone calls. In a meeting, they'd slip a note. So the way that communities were trying to connect people to services was really fragmented and not always reliable. So you never knew if the family that you referred to the shelter, for example, got in, or that a child got a screening that you referred to. So that lack of communication among partners about what happened to that family was the problem that we were trying to solve. So we thought it was a really simple problem, right? We just would create a web-based referral tool and be done with it, right? And until
but there was more.
Yeah, Yes, in fact, and this is an important starting point, because when we were working in social services, we weren't necessarily thinking about healthcare systems and public health in the same way that that other systems were thinking about it. So let me say something more about that. We started small in Southeast Kansas, 8 organizations who were serving kids and families. And we did an evaluation over a 3-year period to see, with our support, whether they could grow a network of partners around that community. So the intent was not only to give a referral tool that closed the loop and solved a simple problem, but also to expand the network of services around children and families. So that was the intent. And our partners down in Southeast Kansas, it's a rural community of multiple counties, rural counties in Southeast Kansas, who make do with what they have and are very creative about solving problems for kids and families. They knew that it would take more than just social services. It would take building up partnerships among public health departments, healthcare systems, federally qualified healthcare centers, clinics, and again, those concrete supports, behavioral health, mental health, substance use. So that's where it blossomed. And I think that's where the space that we're going to be talking about really is. Because what happened is, in a 3-year period, that community went from 8 organizations collaborating to refer families to services and to make sure that they got engaged in services, to a year later increasing by 52 organizations that are now.
Teri, can I ask you a question about that? Is why is that so difficult to do? Because you're giving us an example, and it feels like, why was this not happening before? Can you explain a little bit the mechanism that allowed for that to happen, for the initial 8 to grow to such a number, and why does that lack of collaboration exist in other spaces?
A couple of responses to that. One of the things that we have found is that just providing a technical solution, a tool, is not the answer. It's not just going to magically happen that now that you've got a referral tool or resource directory, that everybody's going to be using it. We knew starting early on that we needed to pair that technology tool with substantial implementation support and a phased approach to building collaborations across sectors, across systems, across partners, and having the real conversations around, what are we going to do differently? What are we, each of us, going to do differently? How can we be accountable to each other? How can we build a true multi-sector collaboration? And that starts, what we have found in the number of communities that we've implemented, IRIS, which is our referral tool, that starts with a key champion. Without a strong champion, somebody who gets the vision, who is taking lead in the community and bringing folks together and saying, we got to work through this. You over there in the health department and you over here in the shelter, we actually need to come together and talk about what we're going to do differently so that the families that we're jointly serving services are coordinated. So a champion in a community, bringing folks together and working through the workflows. So there's a lot of adaptive work that must be present for this to be successful. If you're going to break down barriers in systems, there's going to have to be some conversations about what these systems are going to do differently.
So you mentioned, I think this is a really important topic, because you mentioned that part of the reason that you felt that you perhaps were able to make an impact is that you viewed the system perhaps from a different viewpoint. I wonder if you can expand a little bit about where the opportunity is in terms of this translation work that you're in effect doing, and the lack of you mentioned silos, and how do you break through? How do you make those silos or the walls between the silos more porous?
This is a great question, and it's certainly one we didn't anticipate early on. 4 years ago, we all were younger, and we didn't know what we didn't know. And, we thought we were solving for one problem, which was providing a referral tool for this, the set of partners who wanted to serve kids and families. What we have noticed in that space, social service space, over time is that and I think this is driven by some of the value-based transformation of healthcare systems. What we have started seeing is more vendors. The marketplace has come mostly driven by insurance companies and healthcare systems around value-based healthcare services. They've started to step into this space, and obviously folks on this call around addressing social determinants of health, knowing that health services is but one component of a healthy person. So that space, so folks in healthcare have been working in that space and transforming towards that for however long they have, and they've been coming at it from a very different perspective, knowing that they need to engage with some of these community-based organizations, with those folks in communities that serve families. So they're coming at it from this side, we're coming at it from this side, and what's happening is we're starting to see in communities it's what we're calling a network of networks. And this is where the next innovation is going, where we've got to figure out how to merge systems culture, if you will. Because what is driving the health system is not always what is driving the social service system. Why people get up in the morning to do what they do is likely the same, which is to make people healthy, to get services. But from this side, it's about reimbursement and being able to make sure that a family gets the services that, diabetes prevention services or whatever it might be, which we all are looking at. But what that means is if we're going to bring those two sectors together, community-based social services and health systems, public health, we've got to talk about the ways in which the language and the workflows and the culture are congruent and the ways in which they aren't. You and I had a conversation about silos and systems, education system, early childhood and public health and healthcare. And people don't live their life thinking about navigating a system, but once you're in it, you can't quite flow between the systems. So when you think about some of your human-centered design systems, a person in a community is not thinking, okay, well, now I've got to engage in public health. Oh, that means I've got to do X. Now I've got to go to the doctor and I've got to navigate this. They're looking to flow through systems. And I think the problem that we're dealing with now is A, bureaucracy, but B, that these systems have really haven't broken down the barriers between them well. And so that's what we're trying to do when we come into communities and talk about real talk around accountability. What's the shared vision? What are we all doing here? And what are we going to do differently?
So we know in this moment, let's talk about COVID-19 just for a minute. The U.S. Chamber of Commerce Foundation has said that 50% of childcare facilities will most likely not make it through COVID-19. And of course, we know that this has an impact on families. It also has an impact on families of color. It has caused a number of women to leave the workforce with no idea of when they might be able to return. So where's the opportunity? What do you see in this moment of crisis that can actually help us move forward from those antiquated things that you may have noticed and have found solutions for?
Let me, that's a complicated.
It's an easy question.
Isabel, you know, so let me ground a couple of concrete examples of how our communities that are using IRIS have pivoted during COVID. We've got some folks. So IRIS, let me just do a quick thing. IRIS is the referral tool that we at KU developed and support the implementation of. Our Kansas Children's Cabinet and Trust Fund was the original funder of that tool. We have a team of about 6 or 8 wonderful folks who support the implementation. I think somebody might put the link in the, yep, there we go, Sophie, thank you. It is in 14 communities here in Kansas. It's also in 6 communities in Illinois. We have an IRIS community in Utah. We have one out in Massachusetts, and I'm starting to work a little bit in Missouri. So we've got, you know, about 23 communities, and communities are either county-based or city-based, or however folks come together to create a community. So one of our communities in Illinois, I think it was Quad Cities, which is, you know, I'm looking at a map that that has the Quad Cities. So if folks know Illinois, they know where the Quad Cities are. Let's see. When COVID hit, certainly what we've seen in all of our IRIS communities is a drop in referrals. People went inside, and pretty much direct services went to a halt. Some of our friends in Illinois and also in Massachusetts really took the opportunity to change the dialogue about how they were going to use IRIS during this COVID. So they used it as a rapid response referral tool. So they brought in more partners, they brought in public health, they brought in other folks that would respond to COVID into their existing IRIS networks and really integrated that work. So they used the tool as kind of a rapid response referral tool to address, I mean, what you know happened is lots of needs and nobody, you know, people needing to step up to provide those needs. So from that perspective, what we see is the kind of the adaptive response of communities recognizing we're going to have to do something different in this moment of crisis. What some of the things that you started this question off with, childcare providers are going out of business, women are dropping out of the workforce. No technology tool is going to solve that problem, right? So, but what we can forecast when we think about the future, we can assume that more people, and the data show that more people have basic needs more so than ever. And by basic needs, I'm talking about food, housing, transportation, all of the things that we're seeing suddenly, you know, with people losing their jobs. The social service side of the equation, when we talk about healthcare and public health, the social service side of things are going to take a big hit, meaning more people are going to need the kinds of services that we're talking about, behavioral health, mental health, substance use. And if we as communities don't use sort of the data that we know about from our communities around where services, where the need is, the demand is, if communities don't kind of pivot towards that, we're in a world of hurt. And one of the things that IRIS has done for communities is, you know, over time you start seeing what sectors get the most referrals, in or out. And certainly what we're seeing is a lot of our concrete supports and family supports sectors, they get a lot more referrals than they give out. So I will also say that public health, particularly in Kansas and perhaps elsewhere, is really at a nexus between these two systems, between healthcare systems and social services, because they kind of do both. Sometimes, in some ways, they are like the connector. And what we saw in Southeast Kansas when we analyzed the data around we did social network analysis, if there are any data geeks out there, where we looked at the strength of the connections between the organizations who were referring in and out. What we started to see is, first of all, in that community, 50% of the partners were either public health or healthcare systems. And at the end of our evaluation, they became influential hubs within a network. And I'm trying to help folks visualize kind of a bunch of little dots with interconnected lines. Those are the referrals back and forth. And what we're seeing is that public health departments in that particular community was where the action was. They were referring in and out. They were the connector, and really thinking about how we're going to bridge that systems gap, the culture gap. I think that's where public health can step in. I really do, because at least here in Kansas, our public health departments, local public health departments in each county, do a lot of things. They're often the WIC clinic, the women infant care clinics. They do early childhood home visiting, maternal and child health, all of the other public health systems, community health workers. So they really, I feel like, have a pivotal role in being translators between social services, because they are actually providing social services. Maybe they call it public health, but it's meeting people's needs with the healthcare system that, the value-driven bureaucracy of healthcare systems. We love healthcare systems, but I won't go on about that. But it's navigating those systems and getting care is difficult. Who can act as a translator for a family that's presenting multiple needs? And that's where community health workers, that's where public health, that's where our social service providers can translate and navigate. And I'm going to stop for a second, but I want to plant the seed that what we're also seeing is the role of a navigator or a care coordinator. So folks might be hearing those words, and that is an organization that helps families navigate these multiple systems. If those kinds of models are growing, then that's telling us something, that the systems are too complicated. Not that we didn't know this, that the systems are too complicated for an individual to navigate on their own, that now we've got to create care coordinators and navigators and community health worker models that help people go from here to there. That is one of the solutions. Certainly a shared vision and a technical solution is there, but it's about coming together and collaborating and coordinating in a meaningful way that lifts all of these sectors to equal footing.
What do you think the role of policy can be in moving the impact that you're talking about? Is there one?
I imagine, yes. I'm thinking about, I'm trying there. We've been put in some conversations where we're trying to translate. I'm talking about KU, where we translate between some of the incentives that the policy and dollar incentives that a payer, and I'm talking about health insurance companies at this point, who are active in this space. So insurance companies and healthcare systems are very active in this closed loop referral space. We've got vendors and so there's dollars that are tied up that are contingent upon referring a family and that family going into services. So a doctor says, oh, it looks like you need to, get immunizations. So let me, put you over to the health department. That doctor gets credit when that patient goes and gets the service, and that's the transformation. So what happens is that ends up being a very dollar-driven conversation, right? That certainly payers, insurance companies, and healthcare systems can see the benefit of this collaboration, this coordination to be able to close these loops. That same conversation for social services is not there, meaning that the social services aren't going to be reimbursed at this point for receiving referrals, providing services, and making sure family they're doing it because that is that's why they get up in the morning. So that's a little bit of a disconnect, and figuring out how, I've certainly heard the case from the healthcare side around, oh, the dollars that we're going to save in addressing social determinants of health can go back into the community. How does that happen? How is that actually going to happen? So when we think about policy and redirecting funds or redirecting practice, there's a lot of talk. What will the action be? Is policy going to drive that action, or dollars going to drive that action? I don't know. That's not my space. But when I'm looking at it, I'm seeing that kind of mismatch in motivation, in incentives, in the culture.
What drives you in this work, you personally?
Well, I get up in the morning to make a difference for kids and families, and I do that by trying to solve the sticky problems. And this is a sticky problem. It's a complex problem that doesn't have an easy answer. Those are the things that I like to do. And so, part of it is trying to figure out, how do we make things better for kids and families? And it's our responsibility to create or recreate or redesign or reimagine systems that better serve kids and families. Because right now we know that systems are doing the best they can, but they have grown within their own bureaucracies to the point that people can't navigate them. They can't access the services, and that just is not that's not okay. And if we're not out front thinking about what could we do different, what's a better possible future for kids and families, what do we need to do different, and then actually solving that, we're not going to have the change that we need to have. Because as you know, with COVID, things are not going to go back to the way they were. They must not, because the way they were, and is not going to be the kind of flourishing future that we want for our kids and families. So we've got to put all of our hearts and minds into coming up with solutions, whether it's technical solutions, adaptive implementation, data, whatever it might be. So that's what drives me, is always thinking about what's a better possible future for our kids and families, and then doing something about it. We talk and talk, but we actually have to do something about it. We have to change behavior. We have to change hearts and minds. Is it going to be easy? Absolutely not. But there are bright spots. When I think about, and certainly my Irish team, and I know several of them are on this call, they share bright spots in our Microsoft teams around their work with communities. And these are folks in Irish communities who absolutely believe in doing things better, and who come to the table and have the hard conversations about, guess what? What we did, we're going to have to do something different. We're going to have to compromise. We're going to have to be accountable to each other. We are going to come together and actually collaborate. We're actually going to coordinate, and we're going to figure this out, because we all have the vision of making sure that kids and families get connected to the services they need. And if that is the shared vision, then absolutely the potential is there. And folks get up every day and do that hard work in their communities for their kids and families. And those are the bright spots that really give me hope, because, I can talk all day, but the work is in communities. The work is with individuals, with individual kids, with individual families, and knowing what to do for the future is the work ahead.
And so, speaking of the work ahead, what is your vision for the next few months, years for CPPR and IRIS?
For CPPR and IRIS, one of the things that we've been focusing, so our center is we support a lot of state agencies in our state and other states, and we work in different states on data, evaluation, research, innovation. We're really thinking about the future. We've begun a lot of hard conversations about how do we prepare for a future that of varying degrees of positivity and such. How do we prepare, and how do we maximize our impact for the future? How do we work with the willing that are ready to do something different? And so a lot of what we're trying to do is certainly maintain the things that we do well, but also, what is the future? What trends are we seeing? How do we need to pivot for that? And how do we use that to make systems better, to support kids and families, the state agency, our partners? We've got a lot of work to do in the world, and part of it is thinking about what's next. Because if we don't think about what's next, it will be here and we'll be flat-footed. So so CPPR is certainly doing the good work that we do. We've got 70 staff members at our center across disciplines. Awesome folks that I love working with. We are committed to getting up every day and making a difference. And our IRIS team, which is led by some of the nicest folks you can imagine, they really connect with our partners in the field, and they get up every day to help those folks with the implementation piece. And we've thought a lot about what it means to scale. So this space is occupied by software in some respects. But we know that software is but one solution, and we have really spent a lot of time based on their experience with community partners on what is the implementation framework, what are the constraints, what do we know works, and then translating that and walking alongside our partners in doing that work. So we have an implementation framework. We've identified some of the success factors for when a community actually adopts this shared vision, uses this referral tools, make sure
Can you share a little bit of those success factors? Just
Sure.
to get in the weeds for a minute.
Absolutely. I have 1,900 screens up, so let me pull up one of them because it's right. Oh, yeah. This morning I was getting all kinds of resources available for this very conversation because my team, they know it back and forward, and it's Teri who needs a couple of reminders on occasion. So we've got a number of phases, and we use the analogy of planting seeds. And so there's a lot of groundwork to get a community ready before they take on kind of this multi-sector collaboration. It's building up a champion. It's talking about roles and responsibilities. It's getting data governance in place. It's doing a lot of discussion around how do you actually use the tool? What's going to look different? How do you build out communities? So that groundwork, that readiness groundwork, is key. So before bringing in any kind of tool, we do a lot of the groundwork with our partners. Again, with, not for and by, but with, around preparing them to have the kinds of conversations they're going to have with their community partners. A lot of them have long-standing relationships with each other. Some of them might have long-standing tensions that need to be resolved around referrals and working together and collaborating. So really setting the groundwork is the first phase. And if we don't get that right with our partners, we see that folks tend not to adopt the tool. If we're not, the structure of this really has been driving the adoption of the tool. We've got some research showing these implementation drivers leading to better outcomes, and we're going to be publishing on that. But we've got to, set the groundwork. Then we need to, bring partners together and have these community conversations. That's where the real talk happens, where people get it out on the table about, why aren't you sending me referrals? Oh, you never respond. Oh, I don't have fax anymore. That kind of thing, where you've got to work through the nuts and bolts of what it means to coordinate services. It's a word, but it has to have behavior behind it, behavior change. And so we work with the partners around workflow, how we're going to use the tool, what it means, what success looks like, and then who the right partners should be at the table, who should we start with and then grow, should we bring everybody in, how are we going to use the data, when are we going to talk about it, so a lot of groundwork before we even launch a tool. And then when we launch the tool, Iris, we have some time to refine and reflect. We build that into the implementation piece. So it's coming back and looking at the data and looking at, I see in this community, 20% of the referrals result in enrollment in services. Why is that? And then community members come back together and look at the data and say, oh, it's because, X, Y, or Z. So it's really practice intelligence driven. So data to inform practice intelligence to change practice. And so it's building in the time and the space to use data to drive decisions and to drive collaboration and coordination across these systems.
Amy shared in the chat, in Illinois, some children's mental health system of care communities are using IRIS with great success. The Southwest Organizing Project in the south side of Chicago is an amazing example of how it has transformed community provider partnerships and ensuring that families actually get linked to services. The ability to share the IRIS data is really powerful. So there's your testimonial. We're about to send it to questions. I just wanted to ask you one last question, Teri, from me. I know we have a lot of students in the house today. What is your advice for folks who see an opportunity for public health and supporting communities?
My advice is to find your why. So your why, W-H-Y. So why do you get up in the morning? And if it is to change systems, I certainly encourage that. Think big. Is it to transform the lives of kids and families? Is it to make the world a better place? Find your why and then find the right spot for you. Sometimes it takes a while to find the right place for you to grow in, where your values and why you want to do good in the world match with an organization or a place that shares those values. So that value alignment, I mentioned, I think public health is at and this is not my area, so we've got public health folks on here who could speak more about that. But again, I really feel like public health is at the center point of where things are going to be in the future. If we're going to break down these silos, so that people have their basic needs met, that people are healthy, that people thrive, that kids flourish. The future is different than it is today. Then we're going to need translators and folks who can cross systems and break those walls down a little bit, because people experiencing walls is the problem. And how do we break those down? So I certainly would encourage any revolutionaries out there to think about what they can do to really imagine a better possible future and be a part of that. So that's my plug.
That's lovely. Well, so I personally want to say thank you for having this conversation with me. I know that we have a couple questions. Isabel Magnin earlier asked, your comment about move to value-based case is very insightful. How might health systems work better with CBOs?
Well, I mentioned that there's always this kind of, there's going to be cost savings at some point in this value-based piece, and that those dollars are going to go back into the community. I'd like to see that actually happen. So I would like to, some of these the savings, maybe it's a pay for success model, maybe it's a social impact model, where the payers and the healthcare systems put their money where their mouth is and look at where the needs are. Certainly folks are always going to need health services, but they're also going to need everything else, even more so. So how are we going to increase the capacity of social services, job trainings, behavioral health, mental health, substance use, development, all of these things. All of that is you have to scrap in social services. You literally have to scrap. And how do we change the system so that we're not scrapping? I have some ideas about that, but I will reserve those.
That's going to be in our next webinar. Are there any other questions for Teri? And Teri, I'm so grateful to you for not only highlighting the challenges, but also the bright spots, because I think we have a lot of work to do. And I think I can safely speak for a lot of folks here who are united in that desire to find innovative ways of doing things that will help people. Anybody else with questions before we pass it back over to Michelle?
I'll give a plug to some folks that are operating in this space before we came on, and certainly have been looking at these networks of networks. It is out of the University of California, San Francisco, and it is called Siren, S-I-R-E-N. I'm going to put that in the chat. So if you're looking for, and again, this is from social determinant of health and health equity from a healthcare lens, but they're certainly on top of the field itself. So if this is an intriguing field for you, or if you're thinking about how to do this, and I will say in Kansas City, Missouri, and so forth, this is one of the things that they've been working on for a number of years, which is how do we bring these systems together. We have a number of insurance companies, health insurance companies who have really taken this on, and I applaud them actually for this. Humana and Blue Cross Blue Shield, not to sell anything, but they're coming in and trying to build these community conversations in Kansas City and other cities, because we haven't cracked this nut yet, and the nut is kind of this systems culture clash and coordinating services. I think it's only going to get more complicated when there are multiple tools, referral tools in the space, and multiple champions and multiple sectors driving this work. So it's going to require good and hard conversations about true collaboration, coordination, so that one sector isn't driving it. But it's also going to probably we're going to have some conversations about interoperability of these technical tools. Those conversations are already existing, but if there are multiple tools in a space, we're going to have to deal with that problem.
I have a question for you from Jane Berry. Teri, you mentioned this pandemic is really highlighting the need for collaboration and breaking down of silos. How do you imagine we can keep the momentum going on the need for this work beyond the current crisis?
I can't imagine that we won't be faced with a continuing, I don't want to call it a continuing crisis, a continuing challenge to meet the basic needs of our people. And until we have a fundamental, this is me going off, sorry, I will, but until we have a fundamental transformation in how we care about other people financially and from the heart, we're going to be in this perpetual challenge, which is universal basic income, universal health care, some of these things that would address the challenges. We actually need to get real about that, because it's not going to go away. And there's going to be so thinking about the forecast, housing crisis, people losing their jobs, whole industries may never come back. So what is the transformation? And thinking about education, our children, what is this going to, what new needs are going to arise? Mental health is going to be way up there. Social, substance use is going to be way up there. So we've got to put some dollars into caring for each other, and dollars into the systems and the services that care for people. We can't keep up with this capitalistic model, but again, I won't go on that.
Related to that, Amy Richards asks, as it relates to reorientation of incentives, are there other countries we can turn to as a model?
I would think so. How many people have lost their healthcare in this country compared to other countries during this crisis? How many people have gone bankrupt as a result of having to pay for healthcare costs? I mean, other countries, there are bright spots out there. We've gone to a couple of conferences called Women Deliver, which is around services, international services across the world. There are countries that have figured this out and offer that model. We're a part of the observative, I'm not going to even say it. It's about anticipatory governance, observatory for public sector innovation. So innovation and doing things differently is where it's at. I don't know. I believe we have it in us to do the heavy lift, and I feel like this COVID has really, and the election has really shown, and has shown the need to do something different. Has exposed, if it wasn't already, I mean, this is not a new thing. It's the exposing the strain on the systems and the services. This is not new, and if we haven't seen it before, we haven't been looking, because we're now kind of reaping what we sow, unfortunately, and so it's going to take us all to do something different. I don't have a solution for helping others care for people if they don't already. My bright spot is that there are more folks who want to do the right thing and care about others than there are that are not. I don't want to leave on that note. I believe in the future that people, there's a better possible future, but it's going to require hard work to get there.
Um, Amy, we're going to leave your question of, are there other countries that have social service and health sector systems that talk to each other better for the breakout rooms? But Teri, I think you did leave us on a bright note that there are a lot of people who are willing to roll up their sleeves, and that you said that we have it in us to make that change. So I want to thank you so much again for sharing your expertise, your insights, and being straight up with us as well about how you're feeling and what drives you in this work. I'm going to pass it over to Michelle, and thank you very much again for having me as well.
Thank you, Isabelle and Teri. That was quite an informative conversation, and I just really appreciate all of your time and knowledge today, and for shedding light on how complex these issues are and the work that really needs to be done to transform our systems for the better.